Hello, I'm really pleased to be hosting this session. My name is Jo Rycroft-Malone. I'm the Executive Dean of the Faculty of Health and Medicine at Lancaster University. I'm also based in the new Health Innovation Campus, which is an exciting new space where we're working together with collaborators to fill that gap between research and practice, that application, that innovation pipeline. So really exciting to be here talking about these projects today in relation to how working with universities can accelerate innovation. We know that innovation takes a long time to happen, sometimes up to 15 or 17 years. So working together, academics with industry is a really important way of speeding up that pipeline. So it's great to be sharing some of the projects with you this afternoon. So the first person I'm going to come to share his project is Mohammed Munir. So Mohammed Munir, you're going to tell us a bit about your work and about your work within the university. Over to you.
Thank you, Jo, for the introduction. My name is Mohammed Munir, as you mentioned. I'm a virologist at the Lancaster University. And one of the projects that we've been working on is COVID-19 vaccine, but with a little difference in delivery method, and that is intranasal, that you can just squirt up into the nose. And the primary reason that we've been working on the intranasal vaccine is because we know that the COVID-19 is a respiratory disease, very easy to transmit from one person to another person. So we definitely need to have a vaccine that can block the transmission, and the transmission can probably only be blocked when you have immunity at the entry of the virus. So as we all know that most of the current vaccines, they are incredible in reducing the hospitalization and deaths, which is really these vaccines were made for. The next generation vaccines are required to block the transmission so that people who are vaccinated, they wouldn't transmit the infection to the next person. And by that way, we will be able to have a bit more handle on to this pandemic. And the vaccine that we have developed has certain features that are relatively unique compared to the other vaccines, and probably that is the reason we are proceeding that one further for the clinical evaluation. One of the features is that the vaccine itself is based on a vector that is normally infecting birds, so it's non-infectious for human, but it is harmless, it does not cause any disease in human, and it has a history of around 50 years of safety in the human. So based on that vector, we have built this vaccine. And normally most of the vaccines that currently are being used are based on one gene, that is a spike gene. But we took an approach based on the knowledge that had been gathered for last 1.5 years, that we took two genes. One is the spike gene and one other gene, and that is the internal, probably the most abundant protein within the virus, very critical for the T-cell immunity, because the T-cell immunity is the immunity that is long-lasting and is sustainable for reducing the transmission, but also to cover different variants. And since we are the second generation vaccines, we had the opportunity to take up the most predominant antigens for the Delta variant. As we know, around 92% of the new infections are coming up through the Delta variant. So we took the leverage and taken the antigen for Delta variant, both for the spike and the other gene. So dual antigen based vaccine is probably the first one that will be getting into the clinical trial. Beside this one, the vaccine has a possibility to be lyophilized, to be freeze-dried, so in a powder version. So transportation would not be a problem, particularly in the tropical countries where the vaccine coverage has been relatively less. Because majority of the vaccines, those are having a very good success, they require cold storage. So any vaccine that would have an advantage of transportation at the room temperature would be really an addition into the arsenal for this fight against pandemic. And I think one of the major advantage that really triggering us to develop this intranasal vaccine is the lack of requirement of a specialized medical staff, because the intranasal vaccine, either it can be administered by the person themselves, or volunteer with a very little training can administer the vaccine without any mistake. And that is really something that we are looking very positively to take it into the clinical development and move on into the further development for evaluation. And hopefully, based on our preclinical data in different animal settings, all is very encouraging in inducing the immunity against all variants, as well as T-cell immune responses. So we're really looking forward to take it forward for the safety and immunogenicity in the human. Thank you.
So Manu, can you tell us a little bit about how working with the university has helped catalyse the project that you've been working on, the vaccine project you've been working on?
Yeah, as we can all anticipate that developing a vaccine is really a gigantic project. It involves at least 5 or 6 different stakeholders, from financial, from the legals, from the regulatory sides, and also for the recruitment and the volunteer participation perspective. So the university role has been pretty incredible to really touch upon all of these stakeholders, to provide the support that we put the right contracts in place, to provide the right support that is required to kickstart for these projects, because it's a very expensive project, and having a right partner that can support both logistically but also financially are really critical for the success of this project. And university has been incredible to provide support from all these different angles.
And in relation to the commercial partner that the partnership you've been developing with industry, could you say a little bit more about that?
Yes, absolutely. We are having enormous interest from different industries, from different sectors, primarily because of the route of administration and the advantages of this vaccine, because people have started realizing that the vaccines, those are good in reducing deaths, certainly those are important, but the step next to is intranasal administration to stop the transmission. So we have had several interests from the industries, and one of the partners that we started partnering with was chosen by the help of the university to go through a proper due diligence to look onto their financial backing, because this is the project that does not just require the starting, it does require the finishing, and the finishing up to that point required a financial backing. And the university has incredible experience in connecting with the right expertise and the right people to really kickstart on the projects that are requiring that high level of financial backing.
So this is obviously a really exciting project, potentially really exciting, not just for the UK, but as you've said, for lower middle income countries. And I'm sure people would be really interested to know whereabouts you are in the process in terms of getting to that magic goal of having a vaccine that is out there and being able to be used. Could you tell us where you are in the project?
Yes, absolutely, Joe. I think you really raised a very good point about the need of these kind of vaccines in the developing countries, where we now that at the moment, for instance, in the whole of the Africa, it's only less than 5% of the population is vaccinated. So which means that, of course, even in the small island in the UK, if we have even 90% coverage, we are all together in this pandemic. Until we really have the high level of coverage around the world, it's really difficult to claim any victory in any small country or even a bigger country when it comes to infectious diseases. So we are relatively early stages. We are at the start of the GMP process. The GMP is the process where you make the doses good enough to go into the human trial. So the plan is that by the end of this year, we will be starting our phase 1 and phase 2 trial combined, along with a trial that be used in pre-vaccinated people as a booster vaccine. So if all go fine, by the mid of next year, we will be in the position to demonstrate all 3 stages is safety, immunogenicity, and efficacy against the hopefully the Delta variant, where we will be setting up the trial.
That's great. Really interesting to hear. So all the best with that, the continuation of that project, and there may be other questions that come through, or indeed from our colleagues on the panel as well. So going next to Alistair Richards, who you're the Chief Executive of North West Cancer Research. So you're going to explain a little bit about one of the projects that North West Cancer Research has been supporting.
Yes, that's right. So back in early 2020, we became aware of a quite unique data source, which is the primary care records from 10 years of patients in the Morecambe Bay CCG area. And the Morecambe Bay CCG area is quite interesting because you've got some significant health inequalities in there, some relatively poor and deprived areas, and also some quite wealthy areas. And so this data source will enable us to map cancer cases over 10 years throughout the CCG. And then we're going to use that data to look at how different environmental and socioeconomic factors are causing cancer or are interrelating in order to cause cancer. And that technique is not new. So there's been many different studies that look at, something like a radon gas or smoking or, different levels of deprivation and how those relate to cancer. But what we're doing is that we're going to be overlaying 2, 3, 4, 5 different factors simultaneously on a population group in order to understand which of those factors are increasing the cancer risks, but then how those factors play together and change the cancer risks for the population in that area. Once we've got that data, once we've got those maps, those are going to be shared with the local CCG, with the local hospital and the local GP practices. They're going to go out to charities in the area as well, and it will help people to then design interventions in order to start to tackle some of the sort of high levels of cancer that we've got in the northwest of England. And if people are watching today, I think we're very aware of that statistic that says, 1 in 2 people will be affected by cancer during your lifetime. But actually, if you live in the northwest of England or in the northeast as well, those cancer levels are much higher. And what we see is not just higher levels of cancer, but specific cancer types coming through that are relating to our lifestyle factors and our environmental factors in this region. So actually with this project we hope to understand how those factors are all kind of interrelating with each other, and then to start to design interventions that we can push out into the local community to hopefully tackle some of those higher cancer levels and the specific cancer types that we see around here.
And is that because the analysis that's going to be done on the data is going to enable more targeted approaches to the problem?
That's right. As I said before, there's been quite a number of studies that have looked at single factors and how those sort of relate to cancer. But actually, this is the first time that it's been done on a defined geographic area and looking at more than one causal factor. So actually, we can then, if we can see that, in whether it's somewhere like Barrow or Morecambe, we've got some particular lifestyle factors and also geographic factors playing together, then we can start to design interventions which provide people with the information around early signs, early symptoms, things to look out for, things that will cause people to contact their GP and medical services earlier. And obviously with cancer, the earlier that you can pick it up, the earlier you can spot it, the easier it is to treat.
And I know your charity is very focused on supporting researchers of real relevance to the region, but presumably what you're describing, the outputs of what you're describing, has got actually potentially quite wide transferability.
Yeah, I think what the most interesting stage in the project might actually be where we've understood how all these factors are playing together in Morecambe Bay CCG, and then we start to compare that to the national picture. Because I think at that point we'll learn whether our data is really comparable to the national picture, and it will start to give us some clues which we can feed then into the national debate around cancer. Obviously during the pandemic, one of the things that's happened is that people haven't been able to engage with medical services in the same way. So again, we'll hope to pick up some of those factors and be able to play those back into the national debate to stakeholders and even national charities and government.
And so just broadening out now in terms of as the charities, as I say, supports a lot of research, a lot of different types of research for the benefit of the region. When you're deciding what to fund, what are the sorts of things that you're really looking for?
This has been an evolving picture for us, actually. So if you'd asked me that question 2 years ago, I would have said scientific excellence, and actually, that we didn't really pick at that point around cancer type or particularly relevance to the region. We just took a very global overview about trying to improve cancer care, cancer treatment at a national and an international level. And I think now we're very focused on the needs of the region. So we've been looking at a lot of data that's coming through around those cancer types like head and neck cancer that are much more common in the northwest of England than you would normally expect. So for us, we're looking at, yes, it's got to be an excellent project, it's got to have really well-defined impact, but also it's got to be relevant to people in the northwest.
Yeah. And I know I mentioned the Health Innovation Campus earlier, and I know, Alistair, the the charity was one of our first
Yes,
tenants.
tenants,
So,
yeah.
what attracted you to want to be part of the health innovation concept and campus?
Okay, so perhaps for people that are watching, the Health Innovation Campus is a new building at Lancaster University, and the aim is it brings together the medical school, as you well know, the medical school, academics, charities and businesses all under one roof, with the public coming through as well. And so as a charity, that felt like the right place to be for us. Even during the pandemic, when obviously people have been working from home, it's provided us with real opportunities to meet people that we wouldn't have met, have those corridor conversations with researchers, and just hear about new ideas, new themes that are coming through. So this data that we're working from, that was something that just it came up in a corridor conversation with someone, chatting away, and he said, "Oh, well, we've come across this. It's really interesting. There might be some interesting work we could do from a cancer perspective on that," and that's then evolved into this project. And then I've heard that there are other projects working on the same data. So. Looking at palliative care needs in the region as well. So it's just interesting to see the way that those chance conversations help to influence our direction and our research.
Yeah, and as you say, to potentially also influence the way that the charity thinks about the sorts of things that it does fund in the future, I suppose.
Yes, that's right. It's opened us up to some really new areas. We funded such a lot of sort of fundamental science, and that's been really important. But suddenly we're meeting with lots of researchers who are looking at palliative care, population studies, qualitative studies on patient experience as well. So it's been great for us. A great location for us.
Yeah, that's good to hear. So I'm going to move on now to Mike Mead, who's the Community Technology Manager at Create Education. And Mike, you're going to potentially use a prop, but tell us a little bit about your work.
Yeah, possibly. So I work for the Create Education project. We work with all levels of education across the UK to provide 3D print skills. So we work with everybody from primary school kids up into the teaching hospitals with the aim of developing the skills used in 3D printing for deployment in education. So that could be a primary school teacher teaching the actual skills to do 3D printing, or it could be a teacher using the skills to teach English or maths or any of the STEM subjects, or it could be in a teaching hospital applying those 3D print skills to visualize something or to give new training to a medical trainee. So that could be anything from surgery to orthotics and everything in between. So I brought just a very quick 3D print. This is slightly scaled down just for the purposes of printing it, but this is a skull model that has been made from an MRI. So the MRI data is actually taken in sort of layers, and then we use that to print the parts out. So you can see here what actually look like defects in the print, these sort of little areas of holes, are actually parts of the MRI. So they'll be either missing on the MRI or they'll be missing on the person themselves. Because we're not all one shape, we're not all the same, so why are we learning on all of the same models? So we've done a lot of work in helping the teaching hospitals with visualization projects. So we talk about cancer, and that could be visualizing data. So it could be looking at trends and patterns, but it could also be looking at where cancer lies against other organs and being able to segment that out and print those models out so that a surgeon going into surgery has had the chance to see how everything looks and lies before they go in. We wanted to take that education step to another level. So we wanted to be able to take this physicality and be able to develop the other bits that aren't here. So where do the muscles lie? How do the blood flow lines look? And can a teacher have input into that scenario? So through work with the university, we developed first a tablet overlay where we could have a 3D print to give you a physical restriction. So if it was a bone, then your bone would be your physical aspect. But then we could have the tablet or later the HoloLens to give you a complete mixed reality that would allow you to have a trigger in there. So if I've got blood flow and I'm moving around and I cut something, can I simulate that blood flow? So we're pulling in aspects of 3D printing, we're pulling in aspects of things like gaming technology now, where blood flow and fluid flow is already modeled very well, and being able to overlay those onto a 3D print, how can I give that sense of realism to somebody before they get to that patient? And that's the sort of the teaching end of what we do. We work with around sort of 80% of the UK universities as a supplier, and it's great to be able to see the expertise that they have and have them help us help somebody else.
So you obviously it was started up from a 3D printing perspective, but have sort of expanded into these new space avenues.
Yeah.
How did that happen?
Again, you talk about corridor conversations. We work with a lot of the universities, and we see how our projection of 3D print skills is being combined with what other people in the university do. So I work heavily with the engineering department at Lancaster University, and we could see what they were doing. And it was just a concept of having a conversation with somebody in the hospital saying, oh, how are you doing that? And they had a model with some duct tape and some plastic tubes. And I said, that's not how we should be teaching these people. That's not like what we want to be doing. So we printed them a model, and then he said, oh, it would be great if we could show this. And then it was, okay, who do we know that can help us, because we don't have the skills.
Okay.
So.
And you received some European Research Development Fund
support
to enable that to happen?
Yeah, so we worked with the ERDF project based at the Health Innovation Campus. The universities are full of knowledge. It's the best thing about them. And the ability to use the funding allowed us to develop the prototype. We don't have the skills in-house to do this, but the university has the knowledge base and the funding, as we're an SME, so the funding allowed us to access that knowledge, but it also, allowed them to steer our vision. So it's very easy to come in with let's create the world, but the university say, okay, well, maybe not the world, maybe just a continent or a country. And they sort of bring it down for you and deliver what is achievable, so that we came out with quite a robust prototype that then we could show to the healthcare services that we work with and learn where next to develop. So for us, the ERDF funding was the bit that enabled us to take that first step. Without that and the knowledge of the university, we wouldn't have been able to get the idea from phase one. It just doesn't work for us.
So you've explained sort of where you're up to at the moment. Lots of really exciting things happening. What's the next? What's your vision and what's your next step?
So the next step is we're meeting with the Lancashire Trust, and they will be seeing the system. They've already evaluated the tablet form, so they will then provide feedback on the HoloLens version, the sort of full mixed reality. And we'll
unpack that a bit for those
amongst us who are... So HoloLens is a sort of camera system that you would wear like a set of goggles that gives you a complete mixed reality. So you can still see what's in front of you. So if I hold the skull up, I can still see that, but we can put a digital overlay on the top of it.
Right.
So I could put in something that's not there with the muscles and the skin, and that happens with anything. It could be, think virtual reality, but you can still see what's around you. So they're going to trial that and see how they can build that into their existing practices, because that again is the gap in our knowledge. I don't know how to be a surgeon, I don't know how to teach surgery, but I know 3D printing and I know this bit, so let's use the expertise that's around us. So that's the next step for us, is to get the feedback from the NHS Trust, and then we can invest and look further into that.
So you've explained actually how working with university colleagues and with the funding that you've had has helped you reach where you've got to. What is there anything more, do you think, that universities should be doing to support small, medium-sized companies, enterprises?
I don't know about more. I think like the services are there. It's just knowing how to tap into it. So I know that the Health Innovation Campus is still recruiting SMEs onto their ERDF program, and I think the best message I can give is not for the universities, but for the businesses out there, is to look to your local university and ask the question of what is available, because I'm sure Munir would say that like it's great when a business comes to you and says, I've got an idea, and an academic can turn the knowledge of a paper into a product and to be able to take it forward a step. So for me, the university is quite open usually. It's just encouraging the businesses to go there.
And perhaps there is, though, something more that we can do to showcase what, how we want to do work with people like yourself, with people like Alistair as well. It's probably a bit, a bit of a two-way.
Yeah, for sure. Like events like we're doing today, for being able to speak to people and have the co-location spaces and encourage people to come into the universities, so that they're not these closed doors, big white-walled academic buildings, but to be able to bring people into them and show the work that's being done. Absolutely.
Yeah. And Munir, just picking up on the point that Mike was making about that interaction with industry, I don't know whether you want to say anything more about the relationship that you have developed with your commercial partner and how that has supported not just the vaccine work, but a broader portfolio of work as well.
Yes, absolutely. I mean, the commercial partner we are collaborating with, that they are not only just sponsoring our vaccine project, but they are sponsoring other projects that have not only within the UK importance, but globally onto antimicrobial PPEs, which I think over the course of the pandemic, we have realized how important are PPEs, not only from the supply perspective, but the way they protect the healthcare sector. So I think universities are really great source to really attract these commercial partners and to really showcase them what we offer. I mean, as Mike mentioned, that we have massive information out there on the papers, but I think having a right source that can fund them, that can really leverage into a product, and that would be beneficial for the society at large.
And we've got some questions from people who are listening in as well, so I'm going to try and field at least some of these. One's actually a really interesting one, particularly as we think about the function of a space like the Health Innovation Campus and its sort of connection and gateway to a wider community. And this is about crowdfunding for health innovation. So do any of you have any thoughts on crowdfunding for health innovations, or indeed experience for that matter?
No experience from me.
Any thoughts?
There's a lot of crowdfunding in the 3D print space, so I think it's becoming a very valuable way of developing an idea and a concept. And the best thing about crowdfunding is, more often than not, you already know the audience is there. Half of the time, putting an idea out there, the biggest problem is knowing the audience. So with crowdfunding, I think there's a real value in being able to do that. And for health, I don't see why it should be separated from any other idea. Maybe the process is a little bit longer and a little bit more complicated, and it needs an expert to explain why you can't do this for several £100. But I think the idea and the concept, Yeah,
I think that's a really good idea. And as long as the people that are involved in the crowdfunding understand that they're moving an innovation from point X to point Y, and that there might be other processes afterwards, then it's great.
Yeah. And of course, it relates very much to, there's a huge emphasis on citizen science and how we bring the wider community into actually the work that we do on a day-to-day basis anyway. So there's a question, Munir, specifically for you, which is about how being in Lancashire, and I guess related to that, Lancaster University, has helped your project, but particularly also, what would you say is missing? So it's been a very positive story so far. So maybe some of that, what could we do more of, or what's missing?
Yeah, absolutely. Well, I mean, it's been, broadly speaking, it's been very positive from all perspectives. But I think one of the things that we have had a little bit of glitch is, meeting the deadlines and meeting the expectation in an emergency situation. For example, when COVID-19 comes, literally it became a priority for, from research to entrepreneurship to businesses to pharmaceuticals. So I think probably the area that we have to sort of focus a little bit more on is like acting in time and really making sure that we offer the great science that we have at the right time when it is needed the most.
So timing is critical, as well as the right sort of support at the right time.
Yeah.
Yeah. And so that relates to another question we have around advice that you might give, any of you. So any of you, please do feel free to answer this. What advice would you give to a business considering funding? What's the best place to go, or best people to go to, I guess, as well? Ideas around that one?
To gain access to the funding or to fund something themselves is the question. For access to funding, I would say definitely approach the university and look for, depending on what level of business, I would say SME engagement. Most universities have a form of programme, which, as I say, we've benefited quite heavily from. And you'll find that there's certain universities collaborate with each other regionally. So I don't know where the questions come from, but there will be something in that region to help support that person if they've got an idea and want access to funding, for sure.
I think there's, I was going to say there's industry bodies in there as well, aren't there? So there's people like Bio now that are operating across the north of England, and obviously they're well connected into the universities. But actually, if someone's got an idea, they've got an innovation, going to talk to someone like Bio now would be great, because they can point them in the direction of people that have got similar experience, similar ideas, and that maybe have had success in getting funding in the past. It's just helping people to get through those hurdles, isn't it?
Yeah, indeed. And well, you talked a lot about the Northwest region actually when we were talking about the project area, and there's a question here which I'll direct at you first, but others might would also want to answer it. Why Lancashire, given we're at the Lancashire Innovation Festival? Why Lancashire, and what were the benefits of doing your work in Lancashire?
So for me, I mean, we work across the Northwest, the whole of the Northwest and North Wales as well. I think Lancashire is a great place to live, it's a great place to work, and it's a great place to innovate, actually. We've got so many different communities in a relatively small space. There's so much scope there for the sharing, the development of ideas. So for me, if you take that sort of very mixed community that you've got, and you overlay on it the sort of the resources of universities like Lancaster, UCLan, where we are today, Manchester, Liverpool, there's so much knowledge in a small space. And I think particularly if you live somewhere like central Lancashire, you can go north, south, east and west very, very quickly and access lots of different information sources, lots of help, lots of guidance. So yeah, great place to live and work.
Yeah, I echo actually what Alistair said. Basically, I joined Lancaster University not long before the start of the COVID, so I still consider myself as new because most of the time we've been indoor. So I think it's been an incredible place for me specifically to work within the Lancaster University, because what I can see is that is a pretty fine balance between teaching, between innovation, between different disciplines that you can really pull together. And specifically speaking onto this COVID-19 vaccine, I mean, it's based on a virus that causes infection in poultry. If I would not have the opportunity to work in a university which is a biomedical focus, I would not have brought this one up. Although in the veterinary field and in the human side, we do work onto the same theme, but we relatively get a little chance to connect each other, because there is quite a lot of translational side. And when I speak to Lancaster University overall portfolio, it provides an excellent platform really to nourish and flourish your science. And on a larger Lancashire community, I think it's a wonderful place to live in. I've been living in the other side of the country, but excellent place to grow and raise your children here.
Mike, did you want to add anything to?
I don't need to add anything to that.
Good place to stop,
I might be
actually,
the most
isn't it?
biased Lancastrian ever, so I don't need to add anything to that.
I think actually that's a really good place to stop, because there's no other questions come in from the people who are listening in just now. I want to thank you, each of you, for sharing the intelligence around your projects, for giving some thought to the questions that I've asked you and that the audience have asked you. And great, thank you very much. Really good to hear from you. Thanks.
Thanks for having me.